Again, thank you so much, everybody, for joining. This is the group injury screen for neck, back, and extremities. Going to do my best to get through all of this, but I am going to focus most on the neck and the back. Just a quick introduction. Who we are. Align Modern Health is a fully integrated healthcare company. I often say to my patients, our most successful treatment plans are where we cross-treat. We involve all of these services, and a majority of our patients are in cross-treatment plans, okay? And that includes physical medicine, which is chiropractic care, clinical massage, and physical therapy. Then we also have functional medicine and acupuncture. And also recently added, not listed here, is IV therapy. Pretty rare service to address any vitamin, mineral, or hydration deficiencies. We have an entire portion of our website dedicated to that. So please go check that out for us for more information. And really the benefit of having all of this under one roof is to get to the root cause of whatever problem has brought you in. Okay, because we've learned that treating just a symptom doesn't lead to the best healthcare outcomes. Okay, a little bit about me. Did my graduate studies at National University in Lombard. I specialize in a specific kind of physical therapy called McKenzie method that we'll dive into a little bit today as we go through our assessment and look at the joints of the body. It's basically just a system of classification where we look at neuromusculoskeletal pain. I'm excited for you guys to learn a little bit about that today. I also have a lot of experience in some other things that you may or may not have heard of, like DNS, Webster technique for pregnancy, and motion palpation technique. All right. If you have any questions whatsoever about any of the services I listed or anything about what we go over today, please don't hesitate to reach out, schedule a free consultation. Oftentimes it lasts more than 15 minutes, which we are totally fine with. And we are available at 18 Greater Chicagoland locations. So if I'm not in your area, please reach out to somebody, okay? All right, awesome. Goals of the presentation today. I just want to connect a little bit of the why behind what we're doing. I don't just want to move you. I want you to understand why we're doing it. And two main takeaways. How to assess the range of motion in your joints right where you're sitting today, and a distinction between what's normal during that assessment and what's not, okay? Specifically, we're looking for like reduction of range of motion in joints or faulty compensatory movement patterns as a result of that mechanical issue, okay? Mainly brought on by postures. We've all heard of that throughout our day that kind of lead to those faulty movement patterns. So it's kind of like a two-pronged problem, okay? One example I want you guys to refer to constantly as we go through this presentation is this right here, okay? That is a mechanical issue, okay? I'm putting my joint in end range and it's now warning me that I can't go any further, okay? So eventually, if I leave it here, right, I'll probably be in pain, okay? So this is a mechanical issue. Feeding it ibuprofen probably isn't gonna solve it, okay? Might temporarily alleviate it, okay? Rubbing it might help a little bit, okay? Kind of like touching a hot stove and rubbing your hand to get rid of the pain, but that's probably not gonna solve it, okay? Taking it out of that position is probably the best option. Letting the joint know it has a full range of motion and it's safe to use it, okay? And it's not just stuck in a certain position, okay, is usually how we treat mechanical issues, okay? Mechanical issues typically need mechanical solutions, okay? So think about that as we're kind of going through. We'll talk about what's normal, what's not normal. In terms of the exam, pain is always the last thing to show up, guys. It's always the first thing to leave as well. So that represents a really small timeline. When we're treating patients, we always look at the broader picture and we always create treatment plans to solve issues to resolution based off of this assessment we're going to do that's pretty similar to what we're doing in clinic, okay? All right, sensations during the exam. What's normal and what's not? Normal would be end range discomfort and stretch, and I'll go through these again as I go through, okay? What's not normal? Severe range of motion loss, okay? Paresthesia, pins, needles, numbness, tingling, pain that travels, okay? Pain that results in like weakness, okay? Not normal. All right, something we may want to address. Asymmetry between joints. Are my joints moving unequally? Could one shoulder maybe lift higher than the other? Okay, all of these are things that we need to pay attention to. Disclaimer, none of what we do today is taking the place of an in-clinic assessment or exam. This is just basically general information and general awareness, okay? Again, any questions or you wanna ask anything at the end, please feel free. And always feel free to schedule that 15-minute consult and come in and see any of our excellent providers to get more answers, okay? All right, let's jump right in. We're gonna start with the spine today, all right? That's where we love to start. That's the most logical place to start when we're having issues, okay? And it's the main area of the body that's really affected by what we're doing right now, which is sitting, okay? And we have to do this all day, all right? We'll start with the neck. Right here, it's called the cervical spine. It's 7 vertebrae, okay? It has an S shape, otherwise known as a lordosis, okay? Important job of the cervical spine is to have a ton of range of motion, all right? Side to side is probably the most important. Your first 2 vertebrae up here, okay? They are dedicated to basically rotation, all right? So if we lose this, all right, we can't look over our shoulder while backing out the car, we can't look up. The main reason the neck needs to move a lot is so our eyes could bring in information, okay? Kind of an important sensory stimulus, vision, right? All right, so I'm gonna get started. First movement I'm gonna do, I'm just switch my chair. All right, we're gonna look straight down. This is called flexion. You should feel some end range stretch there, okay? You should not feel any shooting pain, numbness, tingling between the shoulder blades, okay? This is the spine opening. I'm gonna look up. This is extension, okay? You might feel a little jamming or closing down. That's totally normal, all right? I'm gonna switch my chair around. We're gonna go lateral flexion, tipping the ears side to side. Same thing, you should be, feeling maybe a stretch on this side, maybe like a closing down of that side. Nothing painful though, okay, right? Nothing going into the arms, the shoulder blade, anything like that. And it should look the same side to side. Okay, all right, next one, kind of a weird one, all right? I'm gonna have you tuck your chin all the way, okay? When you do this, you're bringing these joints back, okay? This is a vertebrae model, sits in your neck like this, okay? Front and then the back, towards the back of your spine, okay? These are the facet joints that we as chiropractors adjust, and you can see that motion as they open up with that chin tuck, okay, that's an important motion we want to keep in mind, right? You should feel some end range tension and stretch in the back, okay? Next one, we're just gonna jut the chin out. We're all pretty good at this one, right? We're sitting here all day, we have our neck, okay? So we should not feel anything there that is painful, pins and needles, anything like that, okay? End range stretch, maybe at this back part, okay, between the shoulder blades. And the last and most important one, perhaps, all right, is rotation, right and left, okay? We want to go as about 90 degrees both ways, all right? Now I want you to go back, all right? Tuck your chin, all right? And keep it tucked while you rotate, okay? Keep it tucked. Open these joints, keep them open, and rotate. You can see how when those joints are open, you can get further as opposed to when they're jammed, sitting in this position all day, and we go to rotate, okay? It's a very big difference. I want you to tuck the chin and go through all of those ranges of motion again. Looking up, looking down, dipping, okay? That's your homework, okay? It's called retraction, all right? Cervical spine retraction. We're just 3 times a day, 10 reps, bringing it back, okay? Like your chin's resting on a ledge, coming back, 3 sets of 10, Okay, just throughout the day, relax your shoulders and we're going straight back. Next one, I want you to put your arm out, okay? See my arms out, and I'm gonna kind of bend my hand down. As I bend my hand down, I'm gonna lean my neck to the side, okay? This is gonna create some nerve tension possibly, and we're just gonna kind of floss that nerve. We're gonna go back and then bring the hand up, okay? Or the hand down, and the neck to the side. This tensions this side of the nerve. The nerves come down from the brain, run out to the hand, okay? And then we bring the hand up, okay? Up. Simple exercise you could do between your chin tucks, okay? Then I want you to just grab the side of your chair, right? And just bring your head to the side, stretching those scalenes that drop down from the base of your skull to the first rib, okay? Just gently stretching those out, okay? So maybe a set of chin tucks, maybe some nerve flossing, bringing that nerve to and from, okay? Tensioning this part and that part. All right, so that's the cervical spine. That's how we assess it, and that's how we kind of exercise it through the day, okay? Moving into the middle back, called the thoracic spine. You got 12 vertebrae there. Those are a little bit more flexed, so it's a little bit more normal to be kind of flexed over there, okay? All right, the way we assess that is we rotate our chair, all right? And I just want you to cross the arms and we're just gonna flex forward, just like this, okay? Flex, all right? Then we're gonna come up, that's my camera here. And without moving the low back and arching it too much, I just want you to fall back, okay? That's extension. Typically, we lose extension as we sit throughout the day without support, right? We kind of fall forward. Next motion is rotation. This is the main job of the thoracic spine. So just rotate. Again, we should be feeling no wraparound pain. We should feel no nerve sensation going into the ribs. All the ribs attach back into the thoracic spine. Okay, so really important to have mobility in this area of the spine. And a lot of times we lose that as we flex over at our computers or our static postures throughout the day. All right. Okay. So everybody, I want you to take a big deep breath in. And where did that deep breath go? A lot of us looked like this. Okay, we got some work to do on breathing. Okay, we want to breathe into our stomach using our diaphragm that sits right under our rib cage, kind of sink it down. Okay, we really want to expand 360 degrees into the rib cage and practice our breathing throughout the day. Okay. Breathing is super important. The ribs need to expand, okay? So we do that throughout the day. Just practice breathing into your belly. It also kicks in that rest and digest system, okay? That parasympathetic nervous system to kind of reduce stress, okay? So breathing we have, okay, where we're just breathing into our belly. Best way to kind of gauge that, wrap your hands around, kind of like a corset. Breathe into your hands, okay? Then breathe out. Breathe in, breathe out. Also use your thumbs back here to make sure you can breathe into the back. It's kind of a tricky one. Takes a lot of practice, but this is what we work on a lot with patients, regardless of their complaint when they come in to see us, okay? All right, so we have the breathing. We can also just sit in our chair, maybe after we do some chin tucks during the day, and we go. So you can kind of see my chair, and it comes up to about my mid back right here. In the chair, elbows in, just keep the shoulder blades out of the way. And I want everybody to just kind of fall back, get a nice stretch, come back to neutral, fall back. This is thoracic spine extension, okay? The motion that we're kind of missing there because we're hunched over all day, okay? So big one to kind of to go through and keep up with. If you notice, you know, after that coffee's wearing off in the beginning of the morning and you're not in this posture anymore, you kind of sink into this one. Maybe hit the chin tucks, do some nerve flossing, okay? And then do some extension for that thoracic spine, okay? Another one for the thoracic spine to kind of assess a normal sensation. We're just going to go to a wall. Okay, I have a wall right behind me. I want you guys to get your feet all the way against the wall, your heels all the way against the wall. All right, and try and get your shoulder blades flat. Don't flare your rib cage. Maybe take a couple belly breaths. Get ready. Bring your arms up. Okay, and we're just rotating the arms back. If you feel like it's really hard to keep your chin tucked, your head on the wall, your shoulder blades on the wall, and your heels against the bottom of the wall, okay, might mean we have some work to do on that middle back, okay? We should be experiencing no numbness or tingling or excessive tightness or difficulty getting into that position, okay? Should be pretty easy. If we can't get into that position, that might just be where we start with that exercise. Just go to a wall and gain some awareness of bringing those shoulder blades back and down, pinned against the wall, head back against the wall, and arms up. Okay, maybe we don't even do this, which is external rotation of the shoulders. Okay, I'll show you the same exercise for the shoulders, but one minor adjustment a little bit further into the assessment. Okay, I know I'm moving fast, guys. Please drop those questions into the box if you have them. Just want to give you guys as much as I can going forward, okay? Going to go into the lumbar spine now. That's the bottom 5 vertebrae, okay? They're really big. They actually look like this, okay? They sustain a lot of the forces that we put through our body. They support the entire upper body mass, and they're in that junctional area between the lower body and the upper body, all right? So really, really important, okay? Also, I'm gonna break this down, just kind of see what I'm sitting with, all right? I sit with a lumbar roll. Whenever I sit, okay, these are for sale at any AMH location. We just put them in the belt line, okay? So if I don't have this, kind of see how my spine kind of curves throughout the day, all right? We can't sit up straight the whole day. It's impossible, all right? So with this at my belt line, I just kind of go back here, and now I have that good lumbar support. It also is in the shape of an S curve, a lordosis, and we want to keep that lordosis, all right? And you can see when I slouch, I still have that support. My back doesn't start to round. This is really important for the thoracic spine too, and the upper shoulders and neck, because when I start to round in the back, that stuff just naturally comes with it, okay? So supporting the lumbar spine throughout the day is vital to all of the other segments of the spine, okay? I'm gonna take you through that screen. So what we're gonna do is just stand up out of our chairs. I'm sure you've probably all gone through the ranges of motion before. Just gonna have you bend straight down, trace your hands down to your feet, okay? Your feet should be about shoulder width distance. Again, just flex all the way down with that lumbar spine curve, okay? That's flexion. Shouldn't feel any pain or shooting pain going down your legs. It shouldn't feel hard to come up, okay? You shouldn't catch, all right? It should be pretty smooth and clear, all right? Next one, we're just gonna put our hands upside down in the small of our back. And I want you guys to just kind of fall over the hands, okay? Try not to jump the hips out too much or bend the knees. We're just straight, and we're kind of just falling back, okay? Maybe a little bit of pinching, maybe a little bit of end range discomfort, maybe a little bit of stretch, okay? But it shouldn't feel painful. We shouldn't get any traveling pain, numbness, anything like that, okay? Next one, lateral flexion. We're just bending to the side. You should probably get your hand to about your knee, okay? All right, just like this, hand to knee, all right? We don't want any pulling, excessive pulling, or any jamming, shooting pain right here. The same way when we did the thoracic spine rotation, all right? We don't want any excessive pulling here or closing angle, sharp pain there. Okay, that might be a warning that there's something more than just, hey, this motion's restricted, okay? I'm not going to go through rotation, okay, the lumbar spine, because it does rotate, but it only rotates about 5 to 10 degrees. It's not designed to rotate. Most of the rotation in your body is going to happen through that thoracic spine. So a lot of times when we're missing this in the thoracic spine, the one we just went through, we start to get some low back pain, all right? So another thing that we kind of assess, all right? So my exercise for you guys for the low back, all right, is going to be just standing in that position, get out of your chair during the day, maybe 3 sets of 10, and we're just bending back, okay? Bending back just like that, okay? Should really help you maintain that curve. And then when you sit in the chair, grab this right at the belt line and maintain your posture throughout the day, okay? We're gonna move into the shoulder, all right? So the shoulder is an interesting joint, most mobile joint in the body. It's a ball and socket joint, right? And it needs to be mobile, right? We need to bring water and food to our face. We need to push, we need to pull, we need to grab things, we need to pick up our kids. All right, so a lot of issues going on with the shoulder. It might be coming from the neck or the middle back, okay? That's where we start, but I'm gonna take you through a quick shoulder assessment. You could do this sitting down or standing up. All right, first one, I'm just gonna have you bring your arms straight up. This is called shoulder flexion, okay? We should probably be covering our ears. Somebody shouldn't be seeing our ears from the side, all right? And we should be at about 120 degrees at least, all right? I'm gonna have you put your hands out to your side, palms, or the top of your hands out. You're gonna come up, and this is abduction, okay? Abduction, all right? And we're gonna come across, adduction. Again, we should be feeling no closing angle pain. We should have symmetry, left to right. External rotation, try not to move your head, okay? A lot of times we'll do this, or cheat, okay? Just like when we're bending the neck, we might bring the shoulder up. Shoulder should be nice and relaxed when we do this, okay? Right there, all right? Next one, I'm gonna turn around. That's external rotation. Hopefully y'all can see this. We're just gonna bring this hand back. I'll stand up for this one. Okay? This is gonna be internal rotation. We're just trying to get to that opposite shoulder blade, okay? This hand, straight back, opposite shoulder blade, all right? We shouldn't be feeling any sensational pain with those. So it should move nice and clear, and they should be symmetrical side to side, okay? A lot of shoulder issues I find, typically imbalances from the front and back of the joint. Maybe we have too much of this activity here, right? Because this is where we live, right? On our phones. So keep that in mind as you're kind of assessing the joint, where you're missing range of motion, okay? The exercise for this one I'd love for you guys to do, I'll stand up again and show you, is called an athlete stretch. Maybe just 3 to 5 times a day, all right? After you do all those other exercises I assigned you, because I know you're gonna keep up with them, right? You're just gonna go thumbs underneath the fingers, close them, and we're gonna go equal and opposite. One arm goes under, the other goes over the top. It's hard to see because I'm tall. Here, out, and over the top. It'll look like that, all right? And we should look pretty symmetrical. We should be somewhat close in the back. We shouldn't be flaring our rib cage, okay? Just easy and back. Go to the other side and back. Head shouldn't be moving. We're looking for verticality in that elbow, straight up and down, okay? If we're missing a lot of that, might be something we want to look into, okay? That other wall exercise I said I was going to get into with the shoulder is different than the first one, okay? Now I want your heels away from the wall, okay? And I want you to be able to get that low back, that lumbar spine flat, okay? This is a true shoulder range of motion exercise because we're not arching the back to create the motion in the shoulder, all right? Because we're taking that out of the equation. We're flattening the lumbar spine, head back, shoulder blades back. I just want you guys to come straight up, all right? You couldn't get your hand in my low back between the wall if you wanted to. I'm just coming straight back, okay? The thumb should kind of touch the wall over your head, okay? If you can't do that, you might have maybe some neck issues to work on, some middle back issues, and maybe some shoulder range of motion issues, all right? Typical when we sit at a desk all day, all right? Okay, I'm gonna flow into the wrist, all right? This will be the last one that I go into today. I wanted to get to the hip. I'm really sorry, probably gonna run out of time. But if this is a back by popular demand thing and I did a good job, I'd love to go through more joints, okay? Maybe break this presentation up a little bit for you guys. The wrist, obviously, we see a lot of carpal tunnel these days. This is your carpal tunnel right here. And there's a ligament that comes right over here, all right? And that ligament could sometimes collapse and put pressure on nerves, causing pain and sensation changes right here, okay? And then even through the wrist, all right? Good way to test for that, okay? If you're having pain there, all right, is this, and then bring the elbows up, okay? Another test for that, how we assess that, is here, and then we bring the elbows down in the opposite direction, okay? That's something that's causing you a lot of pain and you're sitting like this all day on your keyboard. It's something we could absolutely treat effectively and give you a good assessment on that, all right? Ranges of motion for the wrist, okay? We can extend them, all right? We should be feeling no closing angle pain here, kind of up like this. We can flex them, all right? We can ulnar deviate them towards the pinky, okay? What we're looking for, guys, with all these is any jamming sensation or discomfort opening up, all right? If there's referral pain or sharp pain, that might be a problem. Here's radial deviation, okay? So we have flexion, extension, ulnar deviation, radial deviation, okay? We're looking for any sharp pain, open angle pain, closed angle pain there would not be normal, okay? Little end range stretch of the ligaments, like stretching these extensors on your forearm or in your flexors, totally normal, okay? What we want to do throughout the day, just kind of bring this hand out like this. This will stretch all of these muscles, okay? And then we could bring it down like this and stretch those top muscles right there. Those are your extensors. Those probably get worked a lot sitting at your computer all day, okay? So we're just kind of loosening up just to give you an idea. It's been a long day. I'm at the computer, do my chin tucks, do my extension, maybe hit a wall, do my shoulder flexion stuff, right? Maybe do my nerve tensioning stuff, maybe do this, okay? Assess your joints, okay? If you're really in pain or you're feeling any of these abnormal symptoms or you have tons of loss of range of motion, please note that that will eventually lead to pain and some dysfunction in the joint, okay? We're really good at solving those mechanical problems. Always draw your attention back to that finger, okay? It's the same thing with the finger. How do I treat it? I take it out of the position, okay? Are all problems mechanical? No, they're not. I'd be lying to you if they were, okay? But that's where we like to start, and that's usually a reliable source of the pain, all right? So as we kind of go through our day, all right, and just kind of review that stuff, the neck is really mobile, okay? It needs to stay mobile, right? The mid back kind of suffers the most because it's between the neck and the low back, okay? If one goes wrong with the other, it's usually the middle back that's going to compensate and fall over, okay? A lot of the stuff going on in the upper extremity, in the shoulder, in the wrist and forearm might be coming from the neck and mid back until proven otherwise. Might be referral pain, might be radicular pain due to not enough room for these little nerve roots to come out of the hole right there, okay? So that's a difference between those two kinds of pain. We distinguish that for you, all right? But I just want to give you guys kind of the signs and symptoms that might lead you to, reach out to us if need be, okay? that's all I got for you guys today. I know that was super, super quick. If you have any questions whatsoever, we'd love to answer those for you. And I'll let Janine take it away on this slide.
Thank you so much, Dr. Barrett, and thank you all for joining us. If you do have any questions, you are welcome to enter them into the Q&A feature now. As Dr. Barrett mentioned, you are also welcome to schedule a custom, personalized, free 15-minute consultation by calling us at 312-216-2452, or you can visit us and request that online at alignedmodernhealth.com. We are in network with many major insurance providers, and we would be happy to help you navigate your insurance coverage if you do have questions. We do have some questions coming into the Q&A feature now. One is about getting a copy of the stretches and the content. And yes, everybody that has registered will be emailed a full copy of the recording just as soon as we have some time to edit it in post-production for you to make it available for on-demand viewing. So thank you for that question. And yes, you will get a recording emailed to you that you are welcome to watch on demand over and over so that you can follow along with Dr. Barrett. Let's see, Dr. Barrett, we have a couple of questions here for you.
Sure.
One is a question about coming in for chiropractic treatment and if an x-ray is always necessary, or is it truly customized for each individual and what they're presenting?
The way I respond to that question, Janine, is just a standard of care. At Align Modern Health, we're always trying to deliver the premium standard of care, so it will be case by case. If you are in need of an x-ray, we will explain why. But the short answer is no. I'm not going to say every person that comes in needs an x-ray. It's by medical necessity only and a standard of care viewpoint only.
Thank you. Another question here is about that athlete stretch that you showed where you put both arms out and then one went behind your back and one went over your head.
Athlete stretch, yeah. Mm-hmm.
How much space are we looking to have between our hands? Should they be touching? Should there be space between them? Is there a goal?
Great question. I could talk about this for an hour, but my main thing when I'm looking for that, I do a movement assessment on everybody's second visit in my treatment plans. I use that exact test, and what I am looking for mainly, number one, symmetry, side to side. Is one side looking way different than the other? Is one external rotation way different than the other? Do they need to move their head on this side to get this shoulder back? I'm also looking at shoulder blade winging, okay? On the internal rotation part, does your shoulder blade stay pinned back to your rib cage? That shoulder blade is a joint that articulates with the back of your rib cage. So if it's winging off like that, that's a problem, okay? We need to be able to bring that back and keep it on the rib cage, just like that, okay? So the short answer, after I'm rambling, sorry if that's not answering your question, but I'm not looking for your fingers to lock in the back. No, I'm not. There's not a distance. You'll see research that says we want it in a fist, this, that. I don't look at that. I'm looking for symmetry, and I'm looking for the ability to retract the shoulder blades. That tells me a lot about your ability to pull, okay?
Excellent, thank you. There's a couple questions here about specific kinds of services and specific insurance questions. I'm going to direct those folks that asked those questions to give us a call and either schedule a free 15-minute consultation for questions about those specific types of services and or request a benefits check for your questions specific to your insurance plans. Let's see here. We have a couple more questions for you, Dr. Barrett.
Sure.
This is a great one. A lot of us have probably woken up with some kind of stiffness in our neck or our back. Are the stretches today that you have shared the best way to treat that? Or is that something that we should be more concerned about and seek professional help?
Yeah, first little tidbit I will give you about morning stiffness. because there's so much pressure between the vertebrae and the disc right here, there's a lot of pressure there, okay? Your disc needs nutrients, and because we're loaded by gravity all day, it's kind of hard to get the nutrients and the lubrication into the joint. At night, when we're unloaded and we're laying in bed, we're not against that gravity that's acting down on us anymore, okay? So it's able to nourish and make the disc bigger. Okay, that's why you're always taller in the morning. Okay, and that can create some stiffness because it's rehydrated itself during the night because it doesn't have all that pressure going against it. Okay, so it's normal to have that. Again, any of those warning signs I talked about, really severe loss of range of motion, paresthesia, numbness, tingling, things like that, referral pain, asymmetry, okay, drastic asymmetry. But yes, those first mechanical loading strategies would be my go-to. Okay, I wanted to give you guys the main ranges of motion that were lost and the tools, that neck tuck, okay, that back extension for the low back, this one, the wall, okay, those are great strategies to see. Remember, if we repetitively load and take it out of that position, all right, what is the response? Do we get better? Go through your ranges of motion, look up, look down, do a set of the exercises, reassess them. Do they get better or do they stay the same? Okay, I know that was quick and a lot, but I would say assess, exercise, reassess. All right.
No, that's a great response. And I think that tells us that if we do see improvement after a few of those stretches, probably not something to worry about and just some morning stiffness. But if that
Yes,
stiffness or
correct.
pain doesn't go away, that's the time to seek professional help. So that was a
Yeah,
great answer.
yeah, you always say it way better than me. Thank you.
No worries,
Appreciate
we're a
that.
team. You mentioned a lot about asymmetry just now, and we have a question
Yeah,
specifically about that. Is
yeah.
chiropractic and injury rehab appropriate for feelings of asymmetry in the body when there's not pain present, but just something that folks notice and want to work on when one side feels different than the other?
Yes, yes, that is a reason for care. Because remember what I said, if you're having asymmetry, you have a reduction of range of motion in a joint. Reduction of range of motion typically, not all the time, okay, typically precedes pain, right? Okay. I have reduction of range of motion in this joint. It's bent back. It can't go this way. Okay. If I keep it there for long enough, that's really going to hurt. Okay. I'm not saying that's going to happen in all asymmetry cases. We're all asymmetrical, right? Think about our lives. Gee, think about driving. That's a terrifying asymmetrical activity. Okay. That really builds up. Okay. So we're always going to have a little asymmetry. But if it is something that is bothering you and you think it's something that needs to be worked on, we'll work up an assessment. And yes, the short answer is yes, that would be a reason to address it. You know, you definitely don't want to let that go.
Excellent. Thank you so much. We have time for one
Oh,
more question here.
perfect.
And it's a question for somebody that's aging and they're
Yeah.
finding that they need to invest more time in stretching, but they only seem to learn about stretching and what to do when it's too late and they have pain or they're trying to fix problems. This
Yeah.
person specifically asked about websites or books that they can uh, use as a resource. But what I would actually offer, and I'll be curious if you agree, is that a lot of times content online or written are really, like universal, and they're trying to offer an answer for a whole group of people that might not be applicable to everybody. And this kind of medicine and these kinds of stretches should really be customized to each individual and what you're going through, what your health history is, what your injury history might be, your surgical history might be. And so we often do not recommend going online to look for content or finding resources that are aiming to address problems for entire populations of people, but to really come in for that free consult or to seek professional care, whether it's from us or somebody close to you, that can really offer an individual approach so that we're really giving you the best information for you and not trying to kind of put a Band-Aid on a large population. Is that fair?
That is more than fair. To that person, I'm aging as well. So I think that's happening to all of us. So no reversing that. You said that beautifully. The only thing I'll add to that, they call it the information age, right? I think it's the information age, and I think it's the misinformation age, okay? None of the information is necessarily wrong. It just might not be applicable to you and where you're at right now. One of the best features about Align Modern Health and why I love practicing here, you get to meet people where they are and really exercise your skill set on figuring out what is really going on and what's appropriate for you right now. Okay, I'm not going to give it away. We'll talk about it in the consult if you schedule one, but we have very specific phases of care where we schedule very specific visits. We work on very specific things based on a very, I'm going to say specific a few thousand more times, a very specific assessment and exam that's very thorough, to really determine what you should be doing, okay? If you want Google over that, yeah, that sometimes causes problems.
Totally fair. Thank you so much. Thank you, Dr. Barrett, for joining us today. Thank you, everybody out there that is still with us, for joining and for all of your questions. And thank you to all of you who have provided some comments of gratitude in the chat and the Q&A. Dr. Barrett, just so you know, you got quite a few comments of gratitude, folks that really enjoyed the session and wanted you to know that. We appreciate.
Absolutely.
Great. We appreciate you all joining us today. We hope to see you in 2 weeks for our next Digital Doc presentation on a functional medicine perspective on IBS and SIBO. So a little bit different than what we talked about today. And you can register for that at alignedmodernhealth.com. Thank you so much. Have an excellent day. Cheers.
Thank you.